Hi, this is Nancy and Chuck Lewis at Chuck's Place, and we're here today. We're going to be discussing some more mental health issues at the new Chuck Lewis New Mental Health. Chuck, I have a question for you today. Is there any way that you can tell if somebody is mentally ill? Can you look at them and know that they are mentally ill?
Thanks, Nancy. You know, the thing about it is, that's really interesting. I worked in mental health for over 44 years. And the thing is, you can't just look at a person and tell if they're mentally ill. Because a person can act out being mentally ill, they could fake it, they could do anything they want. For therapists to determine if a person is mentally ill, they have to take a history. But when you see a person that's really struggling with stuff, then you know they have a problem. If they do something that's different from what they normally do, then you know they have a problem. But looking at someone, you just can't tell that they have a mental illness. Most doctors would have to take a history, and they will start off with the basic assumption that people are depressed, because that's the first symptoms you get is depression. Because people start holding in the hormones that they should be using to get their needs met. And when you don't get your needs met, it puts a drain on your body. So the Lewis approach, what we do is we look at the hormones in the system to determine if they have a problem, not an illness, because we don't believe in a person being mentally ill. But we do believe that people have problems in living. So what we do is we use the hormones to help them overcome what problems they have, because the first hormone that you get under stress is adrenaline. So we look at that. But you can't look at somebody and determine that they're mentally ill. That's just not possible. A lot of times people can fake the idea of being mentally ill. When I worked at the hospital, Metropolitan State Hospital, there were a lot of people that came in because they didn't want to go to jail, so they knew what to say. They looked pretty fine. Matter of fact, when I started working in mental health, I worked at the Neuropsychiatric Institute at UCLA. And when I went to the psychiatric ward, I couldn't tell what was wrong with anybody. You had to be able to go further than that. Most of the people had depression. During that time, it was in the early 60s, people were locked up. The hospitals were filled with mentally ill people. And they had all kinds of ways of trying to help them overcome their troubles. But still, the main thing was I could not tell why they were mentally ill. They had all kinds of reasons for it. So that's kind of where it stands.
Okay, well, thank you so much for that answer. Are there any ways that we can tell the audience today things that they can do to help their mental health with the Lewis approach? Are there any things that you could just throw out there, a few of the sentences, maybe a few of the words that they could use if they're under stressful situations right now, to help them to be able to cope with life so that they can have a better life?
Yeah, one of the things that's key to helping a person is to tell them things to do for you. When a person is having a problem and in a crisis, you'll find that most people intervening will ask a lot of questions, and they blame them. Why are you doing that? Don't you know you're upsetting everybody? Kind of pull yourself together. They want the person to do the work. But when you tell someone, do this for me, lower your voice, be nice to me, do these things, they now know what to do. So they can make the decision to know to do these things. But you can't tell a person, why are you yelling and screaming? They don't know why they're yelling and screaming. And what they're going to do, they're going to yell and scream at you some more. So the most important thing is, simply put, when you see a person in a crisis, this may not make sense. Want everything to go your way, and then tell them how to do it. Be as clear as you can in telling them how to do that. If the person's yelling and screaming, do this for me, George. Go sit in that chair, and then wait 5 minutes, then tell me your name. Tell me if you understand that, George. Now, does George have to do that? No. But he knows what to do, and I did not hit their adrenaline causing them to be further upset. And generally, when I worked in mental health, and I went to a situation where a person's throwing things around, yelling and screaming, all I did was, do this for me, lower your voice. They would lower their voice, and when they escalated again, hold it, do it for me, lower your voice. And that's what they did. And you know what happened? At the end of it all, they said, man, you're a nice guy. Can I buy you some coffee? And this happened over and over again because I did not criticize them. When you want things your way, you do not criticize people. Does it sound like I'm criticizing you? Do this for me. Laugh for me. Is that criticism? Absolutely not. Makes people feel pretty good.
Thank you so much. That was awesome. I actually am smiling too. I really appreciate all the time and effort that you're taking out to help all the viewers to have better mental health. And we will see you next week for our next class. Thank you so much and have a beautiful day.